Hi everyone, and welcome to my video on oral hygiene instruction. Today we'll be going over proper brushing techniques, interdental cleaning, and also selecting the right toothpaste and mouthwash. So my patient here is Sarah. Sarah is 32. She's a marketing manager who loves her morning coffee. Sarah came in today because she's concerned about her gum sensitivity, and she also feels that her teeth may be a bit crowded. So, what I recommended for Sarah in terms of brushing would be the modified Bass technique, which I will be demonstrating in a second, and also Charter's technique. So for the modified Bass technique, it's a great all-around method for removing plaque at the gum line. It's angled 45 degrees from the smooth surface of the tooth, angled towards the gum tissue. In this position, there should be a vibratory motion back and forth, strokes slightly circular in motion, covering 2 to 3 surfaces of the teeth. What else? And while you're doing that, it's followed with a thrust or a sweep away from the gums. And it also digs the plaque away from the teeth. So with the modified Bass technique, I like to think AVS, so it's angle 45 degrees, and then you vibrate and you sweep. So I'm gonna grab a toothbrush. Give me 1 second. So with the modified Bass technique, 45 degrees, like this, covering 2 to 3 surfaces of the tooth, and then we stroke, and in a vibratory motion like this. So going back and forth gently like that with the soft bristle toothbrush always. This vibratory and slightly circular motion helps get in between the teeth where calculus and plaque like to accumulate. So like this. And then when you're done, you end on a thrust or sweep down. So like this. Brushing 2 to 3 teeth and then sweeping down. Brushing 2 to 3 teeth and sweeping down. I'll show it on this quadrant. Brushing like that and then sweeping up. Sorry about the dirty toothbrush. This is my boyfriend's toothbrush when he sleeps over, so it's kind of nasty. I'm sorry. I couldn't find a new one. Like that. And then thrusting up. Sweeping away from the gum line, which is the most important with this technique. So the second one that I would recommend Sarah would be the Charter's technique. Sarah mentioned some crowding. So this technique can help clean between her teeth more effectively. So like the other one, it's angled 45 degrees towards the biting surface, vibrating the bristles and sweeping away from the gums. So Charter's technique is similar. Vibratory motion. Just like that. So by gently pushing the bristles against the teeth, you are more effectively able to get in the crevices that plaque likes to accumulate in. So what to keep in mind is that these techniques are good for getting in between, but it should never replace C-shaped flossing, which is super important for effectively getting into proximal. So for tongue brushing, bacteria buildup can contribute to bad breath. So use a soft toothbrush or tongue scraper to gently brush the surface of your tongue, moving from the back to the front, always back to the front, and making sure not to go from the front to the back, so not to push the bacteria back into the mouth. So let's just pretend that Sarah has a tongue here. So we were going to go to the back, forward, back, forward, back, forward, back, forward, back, forward. And what else? So now let's talk about cleaning between the teeth, where brushing can't reach. Because Sarah has some crowding, flossing can be a good option. Here's the C-shaped flossing technique. So I think it's recommended that floss should be the length of your forearm, or 18 inches. So I'm going to take a piece of floss. 1 second, please. And you wrap it around your middle finger. Wrapping around your middle finger. Like so. Like this. Sorry, I don't have a tripod to do this on. So, in between your middle finger like this, and you use your pointer and your thumb to control. Okay, I have to do this in between my knees. 1 second. Okay, so it's gonna be like this, and making a C shape, so you're cleaning two surfaces. This one, C-shaped, pulling out, going in, making another C shape, making sure that you hug the tooth this way and pulling out. Do it on this surface, hugging the tooth, pulling out, cleaning the distal C-shaped and pulling out. And of course, on a real patient, you're going to be taking the used floss and collecting it on your left hand. Well, I'm a righty, so that's what I'm doing. And then dispensing new floss. So you're not using the same piece of floss on the same areas. We do not want to spread bacteria, which is super important, of course. Okay, let's see what else. So we talked about C-shaped flossing. So moving on to rinses, choosing the right toothpaste and mouthwash can further support your oral routine. So for toothpaste, I recommend Sarah, since she has some gum sensitivity, a toothpaste with stannous fluoride can help, would be best for her for reducing plaque and strengthening gums. And for a mouthwash, an antiseptic rinse can be provided for additional support for her gum health. That is all for now. Thank you so much.